Foya Lofa County, northwestern Liberia, a town bordering Guinea and Sierra Leone, witnessed a sick woman returning from Guinea with a hemorrhagic fever. She had attended the funeral of a family member who also died from a strange hemorrhagic fever that had a semblance of Lassa fever. She sought health care at the Foya Boma Hospital and subsequently infected 2 healthcare workers.
So when the patient came, there was not really like a lot of education like today. So they never knew. So when the patient came, they were, the way we used to give care to the patient. While giving the care to the patient, they were not properly, dressed because we never have the idea. So that how this man went to insert IV line. While inserting the IV line, we all know that the disease, this condition, the blood can clot. So while inserting the IV line, there were flashes of blood on the face.
She died and was also taken care of by her sister, who subsequently boarded a taxi and fled to Liberia's capital Monrovia and also died. Although 5 healthcare workers lost their lives to Ebola from the hospital, the death of the first 2 set an illusion of the canary in the coal mines concept.
I think the government of Liberia did not treat the health workers very fine. The government behaved like miners in the past. Miners then used the canary in a cage. When they carry it in a cage in the mine, when the radiation gets very high and the canary dies, then the mine workers take measures to protect themselves, to flee the mine. But in Liberia, it was the same. The government of Liberia did not institute any precautionary measures to protect health workers. They allowed our brothers and sisters to die in their numbers, and there were so many deaths in our country before they started to take measures to stop the Ebola outbreak.
The healthcare system should have instituted adequate measures to have prevented the already limited healthcare workers from getting infected with Ebola owing to the fact that Lassa fever had plagued the region in recent years.
So really our workers suffered, many of them died, and I will say proudly that we were proud of all our workers that died in the course of these jobs. I will continue to put the blame on the government because the government failed to actually do what they were supposed to do. In fact, I remember very well it was PSI that first raised the alarm on the issue of Ebola before other stakeholders and the government officials started now looking at it.
Many skilled health workers continue to work without proper work status. Those involved play voluntary roles in the system. Skilled healthcare workforce per 10,000 people in 2015 stood at 8.6. It was 6.7 at the time Ebola outbreak started in Liberia. This is inside the JFK Hospital Ebola Treatment Unit, ETU for short, through the eyes of an Ebola fighter.
We started with nothing. The PPE were not happening. We only used to wear our long sleeve, our sock, and our uniform. Usually was what we used to do. So it was not easy for us here.
The other healthcare workers at the same hospital staged a go slow again for the lack of protective equipment, as they were the first point of contact.
I'm saying that before we can return to work, we need our month of August salary, we need our proper equipment to use to work with, and we need insurance benefit, we need extra per diem to motivate us because our life at risk. We are at the front page.
Following several cries, the international community came in with help, but the worst has been done. There are no ways to undo the deaths of fallen physicians in the fight.